Okay, so we're doing a COVID-19 charts update. Today's date is May 17th, 2020, and it's Chris and Craig. I'm Chris.
And I'm
The other
Craig.
guy, and there's Craig.
Mhm.
And we're just going to go through Craig's charts. So we'll start with the country comparisons. I'm going to just make this, I'm going to actually put this to the presentation. We'll see what that looks like. So Craig, what do we got here?
Yeah. So yeah, this is the essentially per capita total cases. So you can see that down at the bottom, Australia, South Korea, and China flattened their curves early on, and they've been, they basically squashed it early on.
Yeah.
Whereas the US in blue and Canada in red are still growing, although endeavoring to flatten the curve.
Yeah.
They Canada and the US flattened the curve in the context of the impact to the hospital system.
Yeah.
The hospitals didn't, although they did sort of go through a crisis, they didn't get completely overwhelmed, I don't think. So the countries flattened the curve enough to sort of deal with the hospitalizations
Right.
crisis there, but they haven't flattened we haven't flattened the curve in terms of the continued growth of new cases. You can see that Canada is slowly trying to flatten the curve.
Yeah.
Um, but we aren't doing it in the same way as Germany and France did. They
Yeah.
flattened they sort of saw a spike earlier on, and I think it's because they tested a lot more earlier.
Hmm.
So they counted more cases, they discovered more cases, and they were able to contain it faster and
Yeah.
flatten the curves.
Actually, it will probably help make decisions about where they should allocate resources, and
Yeah.
you know, should I move on to the next one?
Yeah, no, I was just going to say that the U.S., although they're improving, they're still pointed up into the right on a linear fashion. So I'm really hoping they can get it under control and start flattening their curve as well.
Yeah.
Next slide. This is just the same chart, but the log scale, logarithmic to sort of show, relatively speaking, where everyone compares.
Oh, against each other.
Well, it's the same thing. It's just oh, sorry, actually, there's an error on this. It says linear scale on the far left, but it's not.
Oh,
It's a
okay. Yeah.
logarithmic scale.
Yeah.
It's
So
the
nothing.
same information as the last chart.
I guess where people sometimes get confused is they look at this one and they see this thing heading a lot higher, and they look at this one, um, and they go, "Well, how do I interpret
Yeah.
these like differently? Is it because you could say, well, it looks like Canada and the U.S. are starting to flatten. That's a good thing. But then you look at this one and you go, holy crap.
Yeah. This is the more, if you go back one, the linear scale is a more realistic view
Mm,
of the actual numbers. But and that's actually the chart that people should be looking at,
mm,
because it's sort of more accurately represents what's going on.
hmm.
The problem is with when you've got data, you've got lines or curves on that same chart where the numbers are so much smaller in Australia and South Korea than they are in United States. You can't really see the detail down
Yeah.
at the bottom. So that's why, if you go to the next slide, the logarithmic, it's again, it says linear scale on the left there, but it's
Yeah. But
not. It's a
it's, yeah.
log scale. So that amplifies the lower numbers essentially. So you can see, it's easier to see the lower numbers on the same chart as the much higher numbers, the orders of magnitude higher.
Okay. So next slide.
Yeah. So this is just the total number of confirmed cases in these countries, not per capita, just the raw numbers. You can see that the US is almost 1.5 million confirmed cases. Canada's 76,000 almost as of yesterday.
And ECDC is.
That's the European CDC.
Okay. Should I go to the next one?
Yep. This is the per capita total number of confirmed cases, and it's odd to see Iceland at the top, but the reason is that they've tested such a huge percentage of their population compared to other countries. So that's why they've confirmed more cases per capita than the rest of the world. But the numbers to look at there is the U.S. is at 4,435 cases per million people.
Yeah.
Canada's at 2,000 roughly. So I'll show you in a second that if you pop to the next slide, this is the number of tests per capita. So you can see that the US and Canada have basically tested the same number of people per capita. Even though they've got 10 times the population roughly, we've tested the same number of per capita. So the reason that this is important, if we go back to the previous slide, we've tested per capita the same, US and Canada, but they have 2.2 times the number of confirmed cases per capita than we do in Canada.
Ah, right. So can we glean anything from these two charts?
I think that although the US is improving lately, they've tested the same amount per capita as Canada, but they have more than
More
twice as
cases.
many cases per capita. So essentially what that means is that Canada is a safer place right now. There's
Yeah.
more, assuming all things being equal in terms of weather and other effects, climate and that sort of thing. They just have more than twice as many cases per capita than Canada does.
And I wonder if anything around the social distancing and opening up early or inconsistencies in terms of, what stores can be open, when they can be open. I wonder how that's affecting the cases per million.
I think the lesson here I think is that Canada did get on the testing sooner than the US, I think.
Oh, okay.
So we started testing earlier. And so although the total number of tests in Canada and the US is the same now per capita,
Yeah.
the US will exceed us shortly in terms of the total number because they're testing more. They're testing more aggressively right now.
Yeah. Yeah.
So they just got a later start at it than Canada did,
Mm.
and that's why um, there was more spread in the U.S. than in Canada earlier on. So that's why they've got almost 2.5 times more cases per capita than we
Because they didn't
do.
catch it soon enough, I guess. Is that one way to
Yeah,
look at it? Yeah.
I think so.
Okay.
And then this is one of the metrics that the epidemiologists track is the percentage of tests that are positive tests. And so you can see that the US is 13.6% positive. Out of all the tests,
Yeah.
almost 14% of them are positive. Canada's around 6%.
Hmm.
And so from what I've heard, if you're less than 10%, then you're quote unquote testing enough
Hmm.
is
Interesting.
sort of the phrasing that I've heard. Now, the US percent positive rate started out earlier on at 25%. So a quarter of the tests they were doing were found to be positive. Canada's percent positive rate has always been around 6 or 7% in the data since I've been tracking this for the last couple of months.
What was that you said again that you heard that the percentage should be what?
So I think it should be better than this, but in the case of the fact that nobody is testing enough, like
Mm.
nobody's testing everyone.
Hmm.
So given that fact, if tests aren't widely available for everyone, then the benchmark I'm hearing that you want to strive as a country or a region you want to strive to get to is less than 10% positive.
Okay. Okay.
You want to be
So,
under if you're under 10% positive, I'm hearing you're deemed to be testing reasonably well,
okay.
given the fact that nobody is testing everyone.
Yeah. Well, if you look at South Korea, Thailand, Australia, and Taiwan, they are they are seen as the world examples of containment.
Hmm.
Um,
Yeah.
it's interesting. Should we go to the next one?
Sure. Yep. So this one here is a comparison of the total cases over time, and all the countries started at the curves start at for each country when each country saw its first 50 cases in the
Mm,
country. So
mm,
it's sort of comparing an equal timeline regardless of when it started in the country. And so it's sort of an apples to apples comparison of the total cases and the active cases. So you can see Germany in black, for example, when they started to flatten the curve around the 30-day mark, roughly
mm-hmm.
30 to 40
Right here,
days,
yeah.
they started to flatten it pretty aggressively. We've been flattening our curve in red much more slowly.
Mm-hmm.
And so the active cases, basically the active cases for me is a measure of, is the country in recovery mode or are they still on fire?
Yeah. So Germany, this is their active cases load right here.
Well,
Is that correct?
the light gray is China. The black
Oh,
is
okay. Oh,
is
yeah, this one here.
is
Yeah, pardon
Germany.
me. Yeah,
Yeah.
yeah.
Yeah. So for the active
Mm,
cases curve, like I said, is sort of, is the country in recovery mode or are they still on fire? And you can see here that the US is definitely still on fire. Their active
yeah,
cases number is still growing significantly every day.
yeah.
Canada's is starting to flatten. So I hope that, I believe that we're currently at the peak of the active cases in Canada.
Mm,
So if we can continue to slow the growth in new cases, then the active cases curve will start to come down soon, hopefully.
good. Let's go to the next one. So a little more detail into Canada. This looks like a new one.
Well, it's the same chart. I just added another, some more information on it. So this is the daily number of new cases in Canada. And what I was observing, I was just sort of looking at the chart, and you can it sort of appears that this thing is operating in 3-week increments.
Mm,
So from March 15th, when the country shut down essentially, to April 5th, you can see that there was, and the 3-week period is interesting to me because it's kind of the incubation period for the virus,
mm,
from what I understand. So the country shut down, and then the new cases on a daily basis was growing actively at the time, because over 3 weeks, which is roughly the incubation period. And then after the incubation period, because the country was shut down, basically the number of new cases per day settled down and plateaued for about 3 weeks. And then as the country continued to be closed, for the next 3 weeks until this time frame, so it's been what, 9 weeks in total, almost, since March 15th. So you can see the daily new cases in the third segment there, the third 3-week increment is decreasing over time because the country's been largely shut down. It's started to reopen, and essentially I'm interested to see what the next 3 weeks looks like, as
yeah,
because right now the country is, in the process of reopening gradually.
yeah.
So I think we'll see, an uptick in the daily new cases over the next 3 weeks as people are roaming around more.
Mm. So we'll have to keep an eye out for that.
Hmm.
All right, let's move on to the next one here.
So this is a comparison of the daily testing numbers versus daily new cases, because
Yeah,
the new cases is always, it's always relative to the amount of testing that's going on. So
yeah.
the daily new cases on its own is not the whole story. So you need to look at testing related to cases as case growth as well. And so Canada's been increasing testing over time. Some could argue not fast enough, but at least they are increasing testing over time.
Well, what's interesting, because in the earlier slide you talked about the fact that if the, I guess the infection rate is less than 10%, then there is some degree of comfort in knowing that perhaps the number of tests are around right. Is that did I get that right?
Well, yeah. So I mean, what I'm hearing is that if you're south of 10% positive rate, then you're testing reasonably adequately.
Hmm.
I mean, everyone wants everyone to be testing more,
Yeah.
but yeah, it's so yeah, around 6% is a reasonable number compared to the rest of the world.
Yeah. Yeah, and this is testing to see if you have it. It's like it's an antigen test. It's not an antibody test, right?
Right. Yeah.
Yeah. Okay. What do we got
So
here?
this is the same data. It's just the last 14 days. So you've been hearing in the media that public health officials want to see a consistent decline in cases over a 14-day period to
Hmm.
sort of judge whether or not things are safe to reopen. And so that's this 14-day view. You can see in Canada, testing has been increasing gradually over the last 2 weeks,
Hmm.
and the daily new cases is trending down, although it's a bit of a roller coaster. It's not a straight, continuous,
Line. It is and it
you know,
isn't, I guess. Yeah, it's a little bit
well,
of a bump.
the trend is,
Yeah.
but they're not clear on whether they want to see every single day to go down.
Mm.
That's not what's happening in Canada. It's sort of a roller coaster, but it is trending down over
Yeah,
the
that's what
course.
this red line is here.
Hmm.
And here's the trend of tests going up. Okay,
Hmm.
cool.
And this is the last same view the last 7 days. So over the
Oh,
last
okay. Is
week,
this new
yeah, it
to
is.
the
Yeah.
deck? Okay.
Mhm.
And what made you want to go 7? Just because you're very curious, or
Um, yeah, because
yeah?
I don't know why. I just wanted to have monitor this view for a while and see
Okay.
what's going on. It's a short time frame, and they say not to be too worried about short time frames. Look at longer time frames to see how
Yeah.
things are doing. But I just wanted to. It's a good sign that testing's been going up the last week,
Yes.
sig- reasonably significantly, and cases are flat
Yes. Well,
ish.
hopefully that some people from the media will listen to this video and see these charts. And I mean, these charts, there's so many of them, but there's a lot of logic behind what each chart is for, and you know why you have them, why they're being why they're being updated. And okay, so let's go to the next one.
Yeah, so this is the active cases in Canada over time. And you can see, as I mentioned earlier, I do think we're hopefully at the peak of active cases. And as we hopefully continue to reduce the number of new cases each day, that we'll go into recovery mode as a country. Now, countrywide, it's sort of a very high level number. It's very heavily influenced by Ontario and Quebec, where
Mhm.
the vast, almost 80% of the cases are in Ontario and Quebec. So we'll talk more about the provincial
Yeah,
numbers in a moment. But as we're still a country, people are going to travel from Ontario to Quebec and from to and
sure.
fro other provinces. So we
Or
do need
maybe
to look
not.
at it as a country. Yeah,
Yeah,
exactly.
maybe not. Yeah.
Yeah.
So this is interesting in that they're always talking about wave 2 in the fall. um so you know does that, one could think, okay, if there is a wave and it's hopefully not similar in terms of cases, because we're better at um, addressing this pandemic, um, we could be talking about at least a 70-day time frame. Because that's the way I look at it, is if that's what happened in the past, it could potentially happen next time. And hopefully it doesn't. Hopefully it's the time frame is much shorter and the bump is much lower.
Yeah.
I mean, what's the point of having data if you don't sort of look at it and say, well, what can we learn from this, and can we compare against it in terms of benchmarking? Does that make
Yeah,
sense?
yeah. I do think it'll be interesting to see. I'm hoping that the active cases goes down for a bit, and I hope it just doesn't go up too aggressively as the country reopens. I'm hoping
Yeah,
that
that's true.
we reopen responsibly, and people are trying to social distance as much as possible and stay home rather than intermingling and getting too
Yeah,
social too fast.
yeah,
We just don't know enough about how it's spreading, right?
yeah.
Exactly how it's spreading. I think we think we know some ways, but the in absence of a vaccine, or in absence of immunity testing, it's I think we gotta wear masks and stay away from each other for a while.
Yeah. Okay, so what's this one? What do you want to
This
cover on?
is just sort of a summary of Canada. It's the total number of cases in the solid line. The active cases is the dotted line, and the daily new cases is at the bottom, the column chart,
Right. Okay.
just to sort of see it all in the same context.
So moving
So
to Ontario and Quebec.
yeah, so this was, you can see that the total number of cases in Quebec is a little over 40,000. Total cases in Ontario, a little over 20,000. So they have roughly twice as many cases in Quebec as we do in Ontario. It's definitely spreading. They're on fire in Quebec now. Largely, half of that is in the Montreal area. So this is the total cases. If you go to the next slide, this is per capita. So per million people, they have what, 3 times or 300%, I think it is, what we do in Ontario per capita. So it's definitely not great, not a good situation in Quebec.
Oh.
And this is that same sort of view. I was starting to analyze what's going on in Ontario. March 15th was the start of March break in
Hmm.
in Ontario, and so some people went away, some people didn't, and came back to a week later. So the things started to kept growing because the incubation period when people came back from March break around March 23rd is sort of where things started to explode
Yeah.
over the course of a few weeks from there. Um, and I don't have a solid explanation as to why the middle period is still growing instead of plateaued. But
Hmm.
then obviously after everything was shut down and people came back, got home and self isolated for 2 weeks, then the new cases finally started to recover.
And is the data reasonably? Is it reasonably? Is it released quickly on a regular basis for Ontario?
Yeah, it's every day at 10:30 in the morning.
Okay. Should we move on to the next one? This is Quebec.
Yeah. Yeah, their March break was I think it was 2 weeks earlier than Ontario's. So
Hmm.
um, you can see that the things spiked much earlier in Quebec,
Wow.
and they went into shut. That was a reporting error that
Oh, was
night.
it? Okay.
Yeah, yeah. They forgot, or they missed a certain. I think it was
Number of cases.
1,300 cases through the course of April. So I just lumped it into one day, or
Oh,
they
okay.
they lumped it into one day.
Oh,
So
okay.
that's an unusual spike. But you can see that they spiked right after March break when everyone came back, and then plateaued basically, and they haven't started to decrease the number of new cases as quickly as Ontario has.
Hmm.
This is Ontario's daily testing number versus daily new cases over the course of a month. So things are trending the right way in both of those in
Yeah. So
Ontario.
tests up and new cases down, which is
Hmm.
good.
And then same thing for Quebec. They've been erratic with testing. I think that's just a reporting anomaly, but you can see if you follow the trend line, they've been testing more over time, and the
Yeah.
daily new cases have been decreasing, but they just haven't been as aggressive with testing, and the daily new cases hasn't decreased as quickly in Quebec as it has in Ontario.
Yeah. It's like there's if you look at
The
the other one.
Yeah, if you flip back, the angle between the two trends.
Hang on a second. I might have gone too far. There we go.
Yeah, so the angles, the difference in the angle of the gray line versus the green trend line is much better angles here. You want to see tests pointed up and to the right aggressively, and daily new cases going down aggressively.
Yeah. So
So yeah, it's just not as those angles don't look as good in Quebec.
no. And these are linear, right? They're not logarithmic. So these, like, if I look at this, I say, wow, that's a heck of a lot more tests and a lot less cases compared to this, which is a lot less tests and more cases.
Yeah, yeah.
Huh. Okay, what do we got here?
This is same thing for Ontario, just the
For
last 2
14 days.
weeks.
Okay.
Same thing.
Okay.
So this is Ontario, this total summary, new total cases, the green solid line, active cases is the dotted line, daily new cases at the bottom.
So that looks good to me. I mean, that obviously we have more than 20,000 cases, total cases total. Some of the most, I don't know what percentage have recovered, but obviously a large percentage, or 50%, whatever it is. The active cases have gone down,
Mm-hmm.
and there seems to be new cases are low,
Yeah,
which is good.
new cases are decreasing over time, which,
Yeah.
if that happens aggressively, then the country can be in recovery mode, so the active
Yeah.
cases number will decrease. But if you look at it for Quebec here, they're not decreasing, they're not testing as much as Ontario,
Yeah.
and they're not decreasing the number of new cases, so the active cases is still going up and to the right. They're nowhere near being in recovery mode.
Yeah. So we just dive into the U.S., shall we?
Sure. So this is it's the same view. This daily new cases, same thing happened in United States as Canada. Spiked for 3 weeks after shutting down, plateaued for 3 weeks as everyone was staying home, and then another 3 weeks of decline in the daily new cases. Now this is interesting. It's on the left hand scale. It's 40,000 is the y-axis, top of the y-axis. You don't need to go back to it, but in Canada, I made the y-axis 4,000, which is 1/10, which sort of represents the difference in population.
Wow. So in the month or on this date here, whatever that's April 5th or 4th that they had 35-ish thousand new cases.
Yeah.
In that day alone.
Yeah. And so we had, yeah.
This one here, close to 40. And then ours is, I won't go back to the chart, but I guess you could go back and see what is the takeaway between Canada and the U.S.
It's the same pattern in
Okay.
Canada and the US. Like the charts look very similar in terms of the shape of them, but the
Yeah.
US is just so much bigger.
Yeah. Okay.
Even per capita, taking per capita into account.
Okay.
And this is the same data that you've seen for Canada and the provinces, is testing trending up, daily new cases trending down slowly.
Last 14 days.
Yeah. So things are improving in the US.
Yeah, so that is something to feel good about in terms of how the US is doing.
Yeah. Now the last 7 days, you can see that testing's going up, but so are the daily new case numbers. Whereas in Canada, it was the daily new case numbers were flat over the last week while testing's going up.
Right.
So they're not slowing, although they're improving, they're not slowing things down as quickly as Canada.
And here's your active cases.
Yeah, a little worried about that. I'm worried as they reopen fairly more aggressively than in Canada. I think we'll see the active cases. I don't think they're peaking yet on that.
Yeah. Is everything together?
Yeah.
And that's it. Well, thanks, Craig. Really appreciate it, and we'll do this again next weekend.
Yeah, no worries.
Maybe. Yeah.
Happy to help.
All right. Thanks. Talk to you later.
Talk to you later. Bye.
Bye.